Hey everybody, this is Dr. Daniel Choi from North Texas Dental Surgery, Wisdom Teeth and Denture Implant Center.
And I'm Dr. Jed Wooldridge.
All right, so we saw online on YouTube that there was a video talking about millions of people, millions of dental implants that are failing due to lack of training, and we've seen cases like that, right?
Yes.
Yeah, unfortunately. So I literally saw it on my YouTube and just kind of like, skip through it real quick. I haven't really watched it in its entirety. You've never seen it before. So
right.
We just kind of wanted to watch this video, see what it says, and kind of give you our feedback. So without further ado, let's get started here, all right?
Let's check it out.
All right.
Dental implants are rising in popularity, but what the public doesn't know is reports of injuries are also surging. Investigative reporter Chris Pickle uncovered the rising number of problems with this procedure, and what you uncovered should be a wake-up call for the dental industry, really.
Absolutely, and the public in general, because we are seeing dental implants advertised everywhere. And our investigation uncovered almost 500,000 reports of problems with dental implants. That was for last year alone, almost 500,000. And tonight, we are exposing how much training dentists are required to have to perform the procedure.
I don't want to be sick anymore. I don't want to be trying to convince doctors that my mouth is making me sick.
Sitting in a dental chair offers a glimmer of hope for Ginger Peters, who suffers multiple health problems she says started when she got her dental implants.
Just show me how easy it is to pop these out. Ooh, that's pretty decent. Okay.
Between her teeth moving and pain in her mouth, Ginger can't even chew food.
The reason why your prosthetic doesn't fit very well is these spacing is a little bit too close together, and these gold pieces are not tall enough for the lab attachments inside this denture to actually grab onto. So
those posts sticking out of her gums are too small to hold her teeth in place, but the problems run deeper. Doctors James Chaffin and Calvin Brown run CR Smiles Dental Center. They also created the Simply Implant Institute, training other dentists to do dental implants. The implant is a screw-like device drilled into the jawbone. A second piece connects the implant to a tooth or set of teeth. It is a profitable procedure for the dental industry. Online searches show costs range from $3,000 up to $90,000, depending on the number of implants and replacement teeth. The doctors offered to help Ginger after seeing her in our investigation last November.
These are the posts. My gums are in a constant state of irritation.
All right, let's talk about that there. What did you just see?
So primarily it looks like it's a design issue.
Okay.
Even the dentist, when he's talking about the bottom in the design, because if you looked at those lower teeth,
right,
she actually had 4 implants on the lower jaw, but there was only 2 of them that were inside of that denture. So that leads me to think that maybe they couldn't use the other 2 because of some sort of positional issue,
right,
and they wouldn't have benefited the prosthesis much.
So right off the bat, you're telling us that it's not about how many implants you get in.
Yes.
But they have to be, we learned this back in residency, your dental implants that we place have to be prosthetically driven.
Correct. Yes.
So
yeah,
if like I'm laying a foundation and this aspect of the foundation is outside of like where I was originally going to build my house, then what was the point?
They
of
weren't
that?
following the plans.
Right.
Right. So
Right.
I mean, it's always important to begin with the end in mind.
Right.
So have that set of plans for that end goal to begin with, so that you can place the foundation in the proper location to be able to support the house, or
Right.
in this case here, place the implants correctly to be able to support the idealized set of teeth.
So proper planning, but on the other side of it too, coming from a surgical standpoint, even though I may have the plans of where I want to place the implants,
Yeah.
sometimes execution of where we actually place the implants, that can be affected, right?
Yes.
And it looks like, no offense, but we see a lot of these cases like this, right? And we'll go over it later in this video, but we have a patient that came to us on Friday.
Yeah.
Looks pretty damn similar to this case.
Correct.
Right?
Yep.
I do want to take one step back, but she was saying something, remember a few minutes ago, she was talking about how she felt sick.
Yeah.
I think one thing that's very important is that we see this chronically in our industry, but I think there is a failure to listen to the patients. If they're telling you that there's something wrong, then I think that I remember there was one case about, I think like 7 years ago that I did, and it was a patient in Fort Worth. She had an implant placed, and she said that maybe it's like a metal allergy that I have, but like I just know that this doesn't feel right. Like I want it out. And so then I took a look at the x-rays. I was telling her, like, here we are, like sitting 3 weeks later, the x-rays look perfect, right?
Yeah.
Looking at the tissues, there's no signs of infection, inflammation, anything like that. But what am I going to do? I'm going to take it out. You know, you have to like listen to your patients, right? So if this patient's telling you that she's feeling sick, then, or doesn't feel right, you know, we could sit there. Now, when was that? Was that months down the road, right? Was that like 6 months down the road, or was that like right off the bat?
Yeah.
So I think listening to the patient is like another critical factor that I think a lot of times we see doctors don't really pay attention.
Yeah.
So just want to hit on that point also, but let's continue.
Infection? I'm just always sick.
Were you always sick before the dental implants?
No.
That investigation exposed concerns over contamination on implants and that manufacturers do not have to reveal all the materials used in the devices. But it was these quick glimpses of Ginger's x-ray that caught Dr. Brown's attention. A new scan provides a clearer picture.
What's that?
Actually, she has 3 implants, but
Oh, 3. Yeah.
yeah, and that prosthesis, there's only 2.
Yeah. But do you agree with his assessment that basically the locator abutments weren't sticking out far enough?
Yeah, if the attachment can't engage the abutment on those implants,
Right.
then yeah, that would be a concern.
Right.
But
Also,
I
like-
mainly see that being an issue, but also the distribution.
Yeah, the distribution,
It's
right? So
basically, she's got 2 implants, but it's basically one because they're so close
They're too
together.
close.
Right? You need to distribute them so that they can really support those teeth.
So if you had 3 posts for a 30-yard fence, you want them every 10 yards, obviously,
There you go.
right?
Yeah.
Like you don't want all 3 of them within
Every
10
3
yards.
feet or-
Yeah, it doesn't make any damn sense. And that's what you're seeing in this this 3D scan right here in the background, right?
Yeah.
And they have the yellow nerves traced out because that's what we're trying to avoid, right?
Those vital structures, right?
Exactly. So, like, you know, that's why they have that. But anyways, and one other thing about how easily that dislodged, just to let patients know, because a patient who's had a snap-on denture for like a long time and they haven't had the nylon inserts swapped out, that's why that prosthesis can get loose like that.
Yeah.
Right. And it's so just to let patients know about that aspect also. It wasn't that like the implants were improperly placed, like necessarily all
Right.
the time. Right.
Yeah, but sometimes even those abutments, those gold abutments can wear. The nylon attachment can wear that.
The ones
gold
that are
abutment.
like you see in the gums, right?
Yes.
Yeah. So those can wear.
So then sometimes you have to change those also.
Right. So we've created other videos, so you guys can check them out, and we'll link them above also. But we do have other videos that do talk about exactly what some of the issues have been with snap-on dentures. You may see all the problems manifest in a certain way. Long story short, this thing isn't staying in place, right? That's what they'll say. But it could be due to like a myriad of reasons. Is it
There you go.
angulation of implants? Are they too close together? Is an implant failing? Are the inserts wearing? So these are
Yeah.
all just a multitude. So like the reason why we're giving you this information is that to help you guys maybe help like
Understand.
yeah. Because again, we'll talk a little bit more about it later in this video about the patient that saw us Friday, but like I hate to say it, but the dentists were beating around the bush for years apparently.
Yeah, that was like we had mentioned earlier, begin with the end in mind, and they had no end in mind when they started, and it was just basically one appointment to the next, not really having a good idea of where they were going, just trying to provide different options as they went along, and eventually they ended up with a result that wasn't acceptable, and that's not acceptable for the patient.
So I don't know at a certain point, because I do want to give people the benefit of the doubt.
If that's right.
But at the same time, like when that's been going on for a few years, like from a diagnostic standpoint, what this lady was telling us about her story, and again, we're just gonna have to show you the x-rays and show later, but at a certain point, I feel like there's a certain amount of incompetence or maybe just unwillingness to really divulge that somebody screwed up and trying to fix the issue, right? But we'll save that for the end of the video. Let's keep going here.
How many of those implants do you think need to come out?
Right now, I'm looking at least out of the 7, probably about 5 of those implants at least.
Because they're not in the proper position.
That's right.
and they're not the proper size.
That's right.
Examining the images, he says there are several concerns they routinely.
What are your thoughts?
Yeah, so you see all the threads exposed on that last implant on the upper left. Actually, you see threads exposed on all of the upper implants, but that one on the upper left, that's only about, I'd say a third of the way in the bone.
Yeah, because it's up in the sinus there too.
Yes.
So not getting enough support. And he,
routinely see when patients come to them with problems.
And I just see right away that positioning, implants a little bit too large. This one's probably tilted a little bit towards the facial, and that's why perhaps there's some loss of bone right there.
I do want to make a quick comment on that surgically. Okay, so the dimension of the bone affects how we place our implants, right? So what you're seeing right now is a snap-on denture, right? And our goal is always to place your implants as parallel as possible. Right? Sometimes, like what you saw in that 3D scan, her bone's like a little tilted over, right?
Yeah.
So we can't so basically our goal is like we have to work within the confines of like the bone that you have. Yeah, we could do some bone grafting to a certain extent.
Yeah.
But what I would have said right there is that could have helped out a lot in this situation. It was using a narrower implant.
Yeah.
Because that right there looks like a wider diameter implant. Yeah. And a rookie mistake I see a lot of people who don't know what they're doing with dental implants is they're always trying to stick the fattest implant in there.
Yeah.
And like I logically get where we're like what they're thinking. Like a lot of people think that like the longest and fattest implant's always, of course, like the best decision.
Right.
But when
it's not always necessary.
No, it's
right?
not always necessary. Yeah. As in this case, it wasn't necessary. And factor number two is that what you're thinking you're doing is a good thing is going to compromise you over the long haul because you don't have enough thickness of bone around the outer edge of the implant. That bone will start to, what they call dehiss, will start dying off. Your gums will start falling it lower. Your titanium threads will become exposed. Bacteria will get on there.
Right.
Can't keep it clean. And it just is going to further degrade over the long haul.
Yep.
So that's what I see right there. That was a mistake by the surgeon.
It's rubbing, it hurts. It's like having a pebble in your shoe for 10 years. Your whole body's going to hurt.
And it's all engineering. So I see a lot of these, even these simple denture cases, where we'll place 4 or 5 on a patient. A doctor will place 2. Well, 2 is not enough.
Reports of problems with dental implants recently passed 3.1 million. That was over a 25-year span. But it's how quickly reports are now surging per year that is
again, that is horrible distribution of the implants. So, yeah, that's all I gotta say.
Astounding, going from less than 13,000 in 2018 to more than 477,000 in 2021.
What do you think is causing that? Is it just more people kind of like going in and trying to place implants? There's more of a demand too. Like, I mean, like we all know that there's more baby boomers, people who want to get teeth replaced.
Yeah.
And there's more people because they're right what they were talking about in the video. I've never heard of $90,000, but
well, I mean, just anecdotally from what we experience and the people that come to us with implant problems after having previous treatment, it's typically a design issue.
Yeah.
Right? Either their overdentures, the snap-on teeth, aren't staying in, they're not performing like the patient wanted, and when we look at the way that the implants are distributed, they're not really providing support for the teeth to be able to be retentive or also to be able to tolerate the stresses of the bite, so they rock around and things.
Yeah.
Or we have some of these kind of issues where the implants weren't placed deep enough into the bone and you have threads exposed and things like that. So it's primarily, I feel like, design issues where we don't have proper distribution, and sometimes you can have patients with infection issues, and ultimately, if I think about it, and I think from just an experience perspective of seeing these patients often, the main reason for that is probably inexperience on the operator's part.
Right. I totally agree.
More than 98% of last year's reports are categorized as an injury to the patient. Less than 2% are device malfunctions. The most common problem?
So injury to the patient, that can easily be avoided. And the best way to avoid that is with proper imaging, like a 3D scan. When you're doing this kind of dentistry, it's really critical to know exactly where those vital structures are. There's not very many of them. It's primarily your sinuses, your nose, and the nerves that course through your lower jaw. You just have to identify those on the imaging, and then you can plan around them.
Yep. Yep. I agree.
The implant failed to bond or lost its bond with the bone. When that happens, the implant is removed. All this data is located in a FDA database known as MOD. This is crucial information the public should know, but it's difficult to access.
There's a lot of reports that come into the FDA that indicate a device may have failed, and those reports are almost inaccessible to the public.
Madrice Kynard discovered the surgeon reports. The former FDA employee created Device Events, a company that specializes in searching the government database.
So these are catastrophic failures that we're seeing.
The purpose of the database is to monitor issues with medical devices, but the reports are often incomplete and provide limited information.
What we fail to see is what the outcome is for the patient. What did that mean that that patient had to do, or what did they go through? Did they have to get multiple?
So like infection control and things like that in your office, making sure that you have proper infection control protocols in place to avoid like any kind of like water line issues or contamination events, because yeah, that is basically what they're talking about here, that could contribute to failures of implants and infection.
I heard that happened at a pediatric office in like California one time.
Yeah, so
like
it's
waterline issues.
Yeah, infection control protocols. It's it's something that's very basic and fundamental, but it's something that you always have to make sure every single month that you're evaluating and you're monitoring to ensure that you can avoid situations like this.
Right.
Bone grafts to replace bone? Did they have to, did they lose a tooth and never had the ability to even replace it?
Another key question rarely answered: was the problem caused by the device, the patient, or the person who placed it?
I think half of the implants that I'm doing are clinical error, being honest with you.
Do you feel the average dentist is adequately trained to place dental implants?
I don't feel so, no.
When we attend,
Do you agree with that?
The average dentist?
Yeah.
I agree with it.
I agree with
Yeah.
exactly what he said. I think a lot of them are due to surgeon error and lack of training, and yeah, I agree with what he said.
attempted to answer the question, how much training is required to do dental implants, the American Dental Association told us implant dentistry is not a specialty and can be done by any general dentist. Of the more than 40 accredited dental schools we contacted asking if students place implants as part of their curriculums, responses ranged from declining to answer to students have to pass an exam, not complete a certain number of these procedures. The Commission on Dental Accreditation, which sets the guidelines for dental schools, did not respond to our repeated attempts to contact them. Turns out there is no requirement that dental students have to place even one implant during their training to become a dentist. But any dentist can do implants, no additional training required.
So my partners and I, what we really believe is a lot of times there's doctors out there that they don't know what they're supposed to know.
Now, as a patient,
One of my root canal instructors at dental school said that you don't know what you don't know. There's a lot of truth to that. So I totally agree with what that guy just said.
patient, you have the right to ask your dentist how much and what type of training they have when it comes to placing implants. Now, there is more to this investigation. Some people are more likely to have problems with their implants. And coming up tonight at 10:14, we're going to look at the health factors that can cause complications and also concerns that doctors are not properly warning people. Yetta, we'll see you back here at 10:14.
Yeah, eye-opening report. We'll see you here in about 7 minutes, Chris.
I don't want to be trying to
Quick comment, what do you think about like what she just said, like health issues that can contribute to issues?
Definitely. That's definitely something that can contribute to implant issues. And
Like what are the issues that you think of?
the most common ones,
Yeah.
I would say right off the bat, smoking.
You're right.
The second most common is uncontrolled diabetes,
Yep.
because you can't heal well.
Yep.
Those are the two most common problems that can contribute to implant
Right.
problems. There's
and-
more than that,
Right.
but it's in a
Those are the
select
two big ones.
subset of people that are medically compromised. Right.
Those are the two big ones.
Yeah. It's about healing. being
Not
able to heal.
saying that a smoker can't get dental implants.
Correct.
But they just have to stop.
Yeah, and
yeah.
and also understand the
During the healing
risks.
period.
If they understand the risks, that okay, you're gonna embark on a treatment to improve your overall oral health. You could potentially have issues if you continue to smoke.
Yeah. And I've seen some patients continue to smoke after, like an all-on-4 overdenture, and some, like, they were still okay.
Yeah.
And I've seen others that there was just, they lost an implant, 2, 3.
Yeah.
And, like, they just kept on going a pack a day. You
Yeah.
know? And I tried to, like, under-promise, over-deliver and tell patients to put the fear of God in them. Like, listen,
Yeah.
we do not want to redo the surgery.
Yeah, it's why we have our, that smoking cessation talk when we're reviewing
Right.
the medical history and things, and just educate. That's always our goal, and to do everything that we possibly can to ensure success.
Yep.
Right.
All right, let's see what she has to say here.
And convince doctors that my mouth is making me sick.
I think half of the implants that I'm redoing are clinical error.
A lot of times there's doctors out there that they don't know what they're supposed to know.
Earlier in this newscast, our investigation revealed over 3 million reports of problems with dental implants and exposed the limited training that dentists are required to have to perform the procedure. Well, it is important to note that not everyone is a good candidate for dental implants. And we're looking into concerns that people are not getting that warning.
I've done ortho, general, periodontics, endodontics, and oral surgery.
How often were you seeing implants fail?
Probably 4 out of every 10.
Cindy Cantorano spent 40 years as a dental assistant. She says in her experience, specialists such as periodontists had significantly higher success rates than general dentists. She's also concerned patients are not being fully informed that their health
Thank you very much. All right, let's keep going.
issues may cause problems with the implants.
And the doctors, I feel, need to express to the patients more that the implants may not last. They may not integrate well due to their health, their diet, smoking habits. Things like that can also cause them to fail.
We found studies showing risk factors for complications include poor oral hygiene, bone quality, being over 60, smoking, diabetes, chemotherapy, radiation.
Okay, wait a second. Poor oral hygiene. I agree with that. Bone quality. I mean, you might say that like an older female, they may have poor bone quality, but I mean, they could have great success rates too.
Right. Just as long as you're not pushing the limits of, the healing process.
Right.
Right.
Being over 60, no, I'm not worried about that at all.
We've placed implants on 90-year-olds and they have had amazing
fine.
success.
I don't fear that at all.
No.
Smoking, we did say.
Yes, diabetes.
Diabetes, uncontrolled diabetes, yes.
Chemotherapy, absolutely.
Yep. Radiation,
yes.
that's past radiation treatment.
And all of those are attributed to the ability to heal, right?
Right.
Smoking, diabetes, chemotherapy, radiation, and steroids.
Right, because
So
basically
delays it.
Right, when we're placing a dental implant in your bone, you're basically the blood and how it integrates with your informs bone around your dental implant, the mechanical lock it creates with the pore of the implant. You're again talking about chemo, radiation, like these things are basically diabetes, smoking. These are all affecting how the bone would heal.
Correct.
Right. So, and steroids. Okay. Yeah. Same thing. That how it affects your immune system and stuff like that.
Yeah.
All right. So let's continue.
Therapy, radiation, and steroids. And if you look at the extremely high success rates in studies, sometimes used to advertise implants, they do not reflect the real-life success rates in private practices, partly because only ideal patients are used and the dentists are...
I would say that 98% success rate is accurate, assuming that you know what you're getting into, right? You're not placing a really large implant into a very narrow ridge. You're not placing implants on a patient where you haven't confirmed that their diabetes is under control. And you inform your patients about the smoking and things like that. But definitely in my years of implant dentistry, that 98% success rate is very accurate, incredibly accurate. I mean, and
As
more
long as
than,
you know what you're doing.
yeah, more than that, I have patients, you know, that have had implants since the early 80s, late 70s, and they're still in service today. And sometimes I'm incorporating those implants into new designs. So absolutely, they can last, and they can provide people with years of function and comfort and, you know, aesthetic enhancements, but just done under the right circumstances. That's the key, right?
Yep, I agree.
Experts. After Ginger's exam, the doctors plan to work with an oral surgeon, hoping to help her get back some of the quality of life she says dental implants took from her.
I want to build some strength back up and be able to get some food in me and leave my house and interact with the world.
So basically, if we can make when she was saying she was sick, let's make, based off of like life experiences, seeing so many patients and what she's like, I could be totally wrong with this, based off of what she's saying, I think she's sick because she's not able to eat. She's probably having pain.
Yeah.
The dentures aren't working properly.
Yeah.
And therefore, longer term, she's been having these issues, right? Nutrition issues.
Sounds like she has some emotional issues too, because she can't get out and interact. Like, I mean, if you're stuck inside all the time, you can't even eat, you can't interact with people. I don't know about you, but I wouldn't be feeling very well.
Right. Absolutely.
It's really not clear if anyone is going to look into the increasing injuries. The FDA regulates implants, but not healthcare providers. So the FDA does not have any say on what doctors do with these devices. And when I told the American Dental Association about the huge surge in reports of problems and asked if the organization intended to take any action, they stopped responding to my emails. Chris Pickle, Arizona's Family.
Chris, thank you.
Okay. So, I guess if there was ever any issues, obviously, you know, for the patient's like behalf, I mean, they can always contact the dental board, right?
Yes.
So that's like their outlet if patients feel like that they're not being heard by the dentist and stuff like that, or things are going sideways. But yeah, actually, let's like go and like share this case here real quick that we were talking about. All right, so this patient came in on Friday, 78 years old. We took a 3D scan. I'm just going to share basically these dental implants. Do you remember her story, like what she was talking about, like in regards to like? I do remember she said that she lost an implant also because like the snap-in denture actually locked into her mouth, and then like one of the implants became loose after that.
Oh,
do you remember
gosh.
that? It just sounded like like things were going wrong left and right for her.
From the very beginning, because originally apparently like she had some teeth that were failing. So they had planned to remove them and make her a denture, and then, you know, they take out the teeth. They didn't have a denture ready, so they're in the process of making a denture, and then they said, well, that denture would be a whole lot better if you had some implants, and so then they put some implants on the bottom, and then they had planned for just an upper denture. The upper denture wasn't very comfortable, so then they said, oh, well, we should put some more implants on the top. And eventually she ended up where she's at with...
Hold up for 1 second. Yeah. The upper denture not fitting well should not ever be a recipe to immediately head to implants, right? Because sometimes an upper denture is just poorly made.
Correct.
And then somebody could sit there and say, oh, dentures suck. So you need to go to an implant supported option, right?
True. But I mean, if you
But
have...
implants are all...
Oh,
like,
yeah.
No doubt about it.
Implants
are better, though.
Yeah. Made, if it's done, executed correctly, and you have teeth that are fixed on the implants, the outcome of that is going to give you a far better functional end result, and also be more comfortable with things too.
Right.
But again, in this case here, it was they didn't begin with the end in mind, based on the information that we got. Because if you're constantly saying, you know, okay, let's do this kind of treatment. Now let's do this treatment. Let's do this treatment.
Right.
You're just you're headed to a place that you don't know where you're going to end up.
Right. Okay, so like, you know, if I may speak freely, like honestly, hearing stories like this like pisses me off.
Yeah.
Because it's not about taking care of the patient, right?
Yeah, you have to have your design in place.
So here's the bottom line, right? So what we look at today is she's got a lot of bone loss on these remaining implants, right? Like, where's the anterior implant? Is that one of the implants that failed? What about like these lower implants? There's no distribution of these implants, right? AP spread.
They're converging towards each other too.
Right. Angulation of implants is completely wrong.
Right.
Spread of the implants going back into fence posts. Do I want to put all my posts in one area? That makes no damn sense.
And again, all the implant threads are exposed on every single implant.
Right. So this is a surgical disaster and a prosthetic disaster.
Yeah.
Right. And so here's the thing that like upsets me, because if it's my grandma, she's 78 years old, right? I'd be pissed.
Yeah.
Right? And the thing that is upsetting for me is that it's, she told us the story that over the last few years she went back. She doesn't know what's wrong. Would you expect her to? She didn't go to dental school, right?
Right.
So she doesn't know what's going on as to why this denture is not fitting properly. And so to my understanding, the story that she's telling us is that they were just beating around the bush. Hey, maybe we could just change one of the locator, like the inserts, the nylon inserts.
Yeah.
Maybe we change the locator to longer. Like, what does that matter when your angles are all off?
Right.
Right? And there's no spread of the implants. So again, like, it's very frustrating seeing patients like this.
Yeah.
And I mean, I completely feel for them. So, and then also, so she came with her son. And so the other issue too is like, so now she has some sort of esophageal issue, right? So what is this as a 78-year-old female? Like, what, because you're not able to chew properly for the last several years, is this now impacting her life, right? When we could have seen something like this a while ago and diagnosed exactly what it is.
Right.
Your implants have no AP spread. They're all at the wrong angulations. You got a lot of bone loss. Here's what we're going to do to remedy the situation versus...
And here's the sequence of steps that are going to be required to get you to that final place. It's very transparent. You just have that plan and you know exactly step 1, step 2, step 3, step 4 to go, and then you're finished.
Because like, I feel like it's... And then like, I'm 44 years old. You're like 43?
42.
42.
Yeah.
So we're old enough to know that like when we don't know, I mean, if someone's coming to fix our AC or do whatever, like, or fix our car, we don't know like the mechanics of it, right? So they could be taking it for us for like a ride, like we have no idea.
Correct.
And if it's just like, well, I don't know what to do for you, like just throw our hands up in the air, like we put your plumbing in or we put your HVAC system in, whatever it is. And because certain people don't want to take responsibility for an error that could have been made in the past, even though they know exactly what it is, but they don't want to put the money behind it to fix it.
Right.
So there's a complete lack of transparency with the patients too.
Yeah.
And so for us to, if that's my mother or my grandmother, I'm pissed.
Me too, absolutely. I mean, all the time and expense that went into getting to the place that she's at right now to still be in a position where you can't eat very well, you're having esophageal issues. It's disheartening. It really is.
And how much money did she put into doing this? And then now that drained her financial resources, right?
And you can correct this issue. There's a solution for it. Mm-hmm. There definitely is. And, it just starts with the end in mind again.
All right. I mean, she could still do an overdenture, a snap-on denture,
But
remove the implants and start fresh.
Yep.
She could do an all-on-4.
Right.
She has multiple options.
She does.
Right? But again, it's just a little frustrating that now some of her options, I have no idea, but they may be limited financially.
Right.
Because of all the money that she's wasted. And again, it's not about the money. It's about the time wasted in these years where she should be eating whatever she wants and being able to not worry about her teeth and like hang with her grandkids.
Yeah, she's in her golden years.
Yeah. So hopefully you guys got some information about what our thoughts were on that video. Bottom line is, I don't want to throw anybody in the bus, but yeah, definitely there can be a lack of training that comes into play with a lot of these implant issues. Not necessarily that dental implants are going out there causing all of these issues, but a lot of time it's the error of the dentist, right? Lack of training. Maybe there's a lack of caring involved. I think that there should be more empathy. Like when things are going wrong, just tell them, hey, this is what's going on right now. Maybe we need to refer you to somebody else to get this figured out.
Right.
Right. So, any other closing thoughts by you?
Begin with the end in mind.
Right. So proper planning.
Yes.
And just kind of reverse engineer what it takes to get there.
Right.
Yeah. And I think a lot of these issues could be avoided.
Totally.
Yep. All right, guys. Hopefully you guys found this information helpful. If you could, please give us a thumbs up if you like the video, or if you have any comments, questions, please post below. We always try to answer our questions. All right, thanks. We'll see you later.
Thanks.